you got. Good, good, good. Okay, go ahead. Bye. Hey everybody, this is Dr. Warren Kalkstein here at Kalkstein Chiropractic. Today I'm with Nicole. We're here in Baltimore, Maryland. Thanks for joining us on our YouTube channel. So we're going to talk a little bit about our gold standard approach for treating and dealing with anterior shoulder pain. So shoulder pain in this area can come from a lot of different structures. When someone comes in and tells me, especially with Nicole, she's got a history of some gnarly little trauma through car accidents, something we see a lot in our office of. So pain from a car accident, shoulder pain specifically from that car accident. She describes the pain as deep. She describes her shoulder as clinking and clunking when she moves it. So let me just jump right into it. I'm going to do an exam on Nicole, and I'm going to start with her neck, move to her shoulder, and really talk my way through it. So join me. Face me, Nicole. Start with posture. Going to look at her to see if there's any discrepancy. If I see one shoulder hiking up compared to the other, a little bit on that left side here. Have you been lifting anything recently? Any recent increase in activity or anything like that? Okay, this is something that you just repetitively kind of deal with, and sometimes it's worse. Sometimes you don't notice it as much. When you move your arm in certain positions, maybe you notice it a little bit more, especially when you go overhead. Okay. All right, tell me if any of that stuff is wrong or if there's anything new that I'm not getting to, okay? So looking at posture first. And then I'm just seeing how her neck is sitting too. Any neck pain at all, Nicole?
I usually get a little bit left upper.
On the left side?
Yeah.
The shoulder is what's called interdependent with the neck, okay? Biomechanically, as in it relates to how the shoulder moves, is very dependent and connected with the neck as well. So when I move my neck, a lot of the tissues that connect the shoulder have to move as well. So I'm gonna look at the neck first. Turn your head to your right for me. And you'll see that same sided neck pain with shoulder pain from time to time. Actually, quite often to your left now. Good, and the quality of her neck motion is really good. A little restricted when she goes to the right, and I see a little bit more tension on that side. That's what I'm seeing. Let's go ahead and test it out a little bit more. Bring your head back for me. Good, and bring your chin to your chest. So I looked at extension, now I'm looking at flexion. I'm gonna do a little overpressure and flexing to see if it reproduces any pain in her neck. Nicole, interrupt me if you do feel any discomfort or pain. Now go ahead and bring your head back for me. Go ahead, forward, back, back, back. Good, 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 and rotate. Good, and then I'm going to just compress the joints of the cervical spine this way. Any pain with that, Nicole?
No.
Good, awesome. All right, so her neck is checking out pretty good. She does complain about some discomfort and pain here, and then from a functional standpoint, as in the function or the action of those tissues, she's a little tight on this left side. I'll make sure that when I work on her later, I'm not just treating the shoulder, but I'm kind of looking at the chain biomechanically of this, as well as maybe her upper back. Let's see. So shoulder exam, dive right into it. Shoulder flexion, go ahead, thumbs up. Up, 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 up. Good, and come back down. And from that angle, you probably see it, that left arm lags just a slight little bit. Kendra's nodding her head because she's a wizard with exams now. And then left arm, okay, because this right thing is gonna block you. Left arm abduction, thumb facing forward, go ahead. Good, and then come back down for me. So far, so good. Really clean motion. Usually, if like people have some pretty serious stuff going on, it's like, and it stops, right? So just the quality of that arc of motion is good. Now I want to see you do both at the same time for me. Okay, go ahead. Good. A slight little bit of forward head carriage. That scapula needs a little bit of room to move back there because she is. She's not able to extend her upper back, so she's trying to gain it by leaning forward just a tad. Good, Kendra. Good, okay. And then face towards me. All right, so look at shoulder flexion and abduction. Now I'm gonna look at her strength and her rotator cuff specifically, okay? Resist me here, hold strong. Come on, let me see what you got. Good, 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 good. Is that the best you got? Come on, there it is. Fire, 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 fire. So she's a little limited on this external rotation resisted here. Now I'm gonna look at her ability to internally rotate. Now go ahead and push your wrist hard. Hard, 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 hard. Good, a little restricted here too. Just kind of a little weak on this shoulder, just in general. Again, this is chronic, so you'll see some muscle weakness for these type of things. Arms like this, go ahead and do the other arm as well. Just compare side to side, okay? Empty again, go ahead and hold strong. Okay, so sorry I'm pressing so hard, but I want to reproduce it. Does that cause discomfort or pain?
Oh, yeah.
Yeah, on the front of that shoulder there. Okay, so when I compress everything, What could be causing that type of pain? A lot of things. So I'm gonna hold your arm up like this. I'm gonna push down and lift up. Hold strong for me, okay? So this cluster of tests gives me a little bit of a specific, really don't like that.
No.
So, and that's kind of getting in a little bit closer to this, let's call it like a triad of tissues. Bicep tendon, AC joint, supraspinatus tendon, subacromial arch, the bursa, even the deltoid muscles a little bit in that position. So like rotator cuff and the joints and one tendon of the bicep coming up from the front, all those things together, I'm stressing them in those positions. So the shoulder is irritated. Functionally speaking, when it gets rolled in, and it might be kind of in that position a little bit as well, it doesn't like it. So what do I need to do? What is my gold standard for treating anterior shoulder pain like this? Ready?
Oh yeah.
Dry needling, class 4 laser, soft tissue manipulation and adjustments. Those two are come hand in hand. Moving the structures. Let's repeat that again. I'm gonna dry needle her bicep tendon, the supraspinatus tendon here, specifically where she gets a lot of that deep aching pain, where I think a lot of that discomfort is coming from. I'm gonna follow up with class 4 laser right here, and then I'm gonna make sure that your upper back is moving better so the scapula can sit a little bit better in that position, so the shoulders can do the job that they need to do, as opposed to you agitated, rounding all the time. And that's okay, it's really common to see. We just gotta kind of work towards it. So that's how I get rid of the pain. I'm gonna show you those treatments kind of coupled together. We'll show you those, how that works, as well as the some of the most important thing, the follow-up, how to keep it that way, because I get rid of pain all day long, but I got to give you the tools to be successful, to get strong and improve your posture and improve your ability to load that shoulder and to do your thing.
Yeah.
Do all of the things you want to do. Like, you want to be a chiropractor, right?
Absolutely.
You got to be strong in that shoulder.
Yeah.
Say it again.
Strong.
Strong. All right, let's do it. Come watch. Everybody, welcome back. It's Dr. Warren. We're going to show you the first part of that treatment program that I talked about for anterior shoulder pain or front of the shoulder pain. And in Nicole's case, this is from a car accident, okay? So I'm going to be working on first the bicep tendon, and I'm going to talk a little bit about what I found that was positive in her case. Do you remember, Nicole?
Flexion.
Oh yeah, I gave you that one, flexion, just a second ago. So flexion, you had about 170 degrees of flexion. You might have a little discomfort here, okay? So, a little discomfort.
Yeah.
So flexion.
A little bit of decrease in adduction.
A little bit decrease in abduction of the shoulder, okay? No wrong answers.
I cannot remember the name of the test, the shield one.
Hawkins Kennedy?
Yeah, that was it.
Okay, what does that look for? What am I doing when I do that? What do you think? What does it feel like?
You're testing the rotator cuff.
Okay, it's an impingement test, and part of the rotator cuff can get impinged for sure in that test. So the Hawkins Kennedy test, where I had her arm like this and I cranked it, that created a little bit of a discomfort, a lot of discomfort right here on that one. I really tested it out because I wanted to see what was going on.
A little decreased strength with internal and external rotation too, which I found.
Okay.
Right?
That is correct. Internal and external rotation were decreased on that left side compared to right, and grossly, I think a little bit is on both sides. Just shoulder stability in general would be something that I would want to say, why aren't these shoulders cooperating on both sides?
Yeah.
But yeah, definitely.
I don't remember anything else.
Okay. Remember the one where your hand was like this?
Empty can, yeah.
Empty can, that's right. So, give me the big picture right there. You had a little decrease in the way that the shoulder moved, and when I loaded the anterior compartment of the shoulder with force, there was pain and weakness.
Yeah.
And then, okay, so that was kind of the bicep septum as well as the tendon I'm working over around the deltoid, and now I'm gonna find my way up towards the AC joint. I'm gonna come down right where this bursa and supraspinatus tendon come in, and I'm gonna needle right in that space. It's very, very powerful, especially for these chronic shoulder problems. For a couple of reasons. One, pain, but two, also just, I want to get blood flow to that tendon, and this is an effective way to do so. So just palpating through the AC joint, going right underneath that arch. And now I'm high, I'm gonna scoop, and there it is, perfect. Good, a little tender in there. Okay, so overall though, people, I keep forgetting this. People watching this are like, what is he doing? What do needles feel like? How was that so far?
Felt like maybe a pinch, maybe.
Okay, like so far there's been some pinches, some discomfort, but overall, pressure, maybe like a deep ache in some spots.
Yeah, nothing bad.
Usually I describe it as like, I'm gonna find the area that's bothering, you're gonna feel it for a moment, and then you're gonna relax.
Yeah.
It's almost like touching the pain, if you will, that you experience when it's bad.
Yeah.
Right, and then as you're relaxing there, how does it feel like now?
Barely feel them.
Okay, good. So all the things that kind of can push us forward, I'm gonna work on the pec in this position here. There, get a little twitch in the muscle there. Twitch response in the muscles, normal, okay? And the different fibers, pec, minor, major, coming across. So bicep tendon, supraspinatus insertion, pec, working these areas, okay? So I'm really gonna focus on the front of the shoulder where the problem child is, if you will, okay? That's step one. I wanna get blood flow to that tissue, I wanna calm down the pain. Step two, and you'll see in a second, is class 4 laser, deep heat to the area, okay? So I'm prepping it for the change that I wanna create. And this is the prep, this is kind of like the first catalyst. And then the laser comes in and makes us much more efficient at that turnover, at that change that I want to create in the tissue, okay? I remember the PTs from Johns Hopkins came and they brought out this outline and they were talking about fascia, and I love the way that they described that. It's like dry needling can be the prep, and then the laser can come in and make the tissue efficiently turn over in a positive way. When I say turnover, kind of create a positive impact in that area. And so, especially as it comes to injury recovery, okay? And then I'm gonna follow up with the function of the joints. I'm gonna work on the spine, I'm gonna work on the shoulder, I'm gonna get it to move better. That's my job here. That's how you efficiently treat this shoulder problem. And then what's your work gonna be? What's your job gonna be? What do you gotta do in this situation? Is it gonna be healed completely or gonna be fixed?
Absolutely.
I hope so. I mean, it's wonderful when it works out that way, but not often.
Working on some shoulder stability.
Yeah, like gotta move it. You gotta load it. You gotta create a little bit of your ability to sustain it itself, right? And that's just kind of creating PT rehab, strength training all around that shoulder in a smart way.